All right, so first up we have Vdot, and what was the name that you gave yourself?
We had a couple.
Okay.
Consider us the opioid crisis task force from Vdot.
All right, there you heard it from them. So all right, let's get started.
Thanks, Tony. I don't think so.
Great.
Well, good afternoon, guys. We're Vdot's team. We're so happy to be here. Excited to share what we've put together. It's such an honor, such a broad but serious topic this year, and so again, we're all just honored to be here. So I'm just going to talk a little bit about our approach. And looking at this, there are so many facets of the opioid crisis. And so what we tried to do was go really narrow and figure out how can we make a big difference in this two-day event. So we found this staggering statistic that 80% of heroin users get onto heroin starting out by abusing prescription drugs. So if we can stop addiction early, if we can do something, build a tool that can help providers and patients stop early, then that's where we are going to focus. So what we're proposing is a pilot. Now, there's lots of existing technology out there that works with our prescription database. There's some middleware services that are providing information back and forth, working to get electronic health records in sync with the prescription management program, monitoring program, So what we saw a gap in the data is how many prescriptions are folks really taking? We have kind of these standard quantities that are prescribed, and so what do folks do with these extra quantities, right? And so what we think we can do is provide, one, a way to capture that data, and two, a way to feed that back to the doctors, to the prescribers, so that they can see kind of a usage versus prescribed view. And then ultimately, we think that can help reduce the tendency for folks to get addicted and then move into worse and worse drugs in the addiction cycle. So what we found is, let's start small. So let's look at somewhere close by. So we started looking at Henrico County since it's close, the data was available, but also because it's representative of the state. We have rural components, urban. It's also in line with the state percentage for opioid prescriptions. So what we did was kind of heat map based off of drug crime to say, look, where are some areas where we can really start to engage with the community and find ways for us to help, but also to gather that data. And so we picked out 10 spots where we think we could engage with the community and either have existing locations where folks can come, or provide either a mobile site or a pop-up where we can provide services, entice folks to participate and give back not only information, but if they have excess pills, we can get that to the right place as well. So what we're thinking is, look, folks need a tool to find out how to get to these places. How do they know where they are, information about the events? So we built a tool for folks to easily navigate so it geolocates where they are, and then they can find events that are close by. And so you can see it's pulling up directions now, gives you turn by turn. It's very simple, very easy for users to get actually to these events. So what we would do at these events, like I said, is provide these types of services, try to get folks engaged, find out a little bit more about what their usage patterns look like so that we can feed that back to the professionals that are prescribing. So you can see it's a very short survey. Lots of the feedback we worked to get was, look, if people are actually going to participate in this, it's going to have to be very, very simple. So we're really just focused on, look, if we can find out who's prescribing, and find out some information about that original prescription, then we can show a percentage back of how much did they actually take. So what we developed here is a view for the actual providers to look at and see, look, this pie chart here is showing that about 15% of the medication is unused that we got back. And so you can see they can benchmark against other local physicians, professionals, can find out more geographic information. Are my prescriptions ending up in places that we didn't expect them to be as well? And we also created a more Thanks. Generic view for lots of different stakeholders. We see emergency responders, emergency management folks coming in, using this type of data to stage resources, stage ways to engage in the community as well. And so at the end of the day, we're here really to help shape policy to save lives, and such an honor to be here. And this is just a representation of folks that have submitted pictures of their loved ones. Thank you very much.